Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for June the 17th. Starting off with the numbers, here in Shelby County, we have now confirmed 99,466 cases of COVID-19 disease. We've had 5,202 in Fayette County, Tennessee. In Tipton County, we've had 7,465 confirmed cases. Crittenden County, Arkansas, 5,781 confirmed cases. And in DeSoto County in Mississippi, 22,276 cases have been confirmed so far. In terms of the vaccination campaign, we're at 377,626 people have been vaccinated with at least one dose. And we've averaged over the last 7 days 1,410 people being vaccinated per day in Shelby County. We're averaging 47 cases per day diagnosed, and that is a little bit of an increase from where we were a few days ago. As far as the vaccine campaign, we're at 53.9% of the vaccine campaign goal being reached. About 40% of the people in Shelby County have received at least one dose of vaccine. Now, as you have heard from earlier in the week, we do have the Delta variant here in Shelby County, and now we have 14 confirmed Delta variant cases in Shelby County with 10 probable cases. So those are the same people we talked about on Tuesday, except we've gone from having 10 confirmed and 14 probable. We've now got 14 confirmed and 10 probable. No new people, though, at least as of this afternoon. And one of the other things that we're hearing a little bit about is people are not certain, and some people may not be certain about where to go to get tested, and we have seen a drop-off in people being tested. All of the test site options that used to be available are still available. We've maintained those, but if you need to be tested and want to make sure whether or not you have COVID disease, please go to the City of Memphis test site page, and all of your options are listed out for you there. Testing remains free and available throughout the county for citizens. We've got at least 16,000 test appointments per week that we still have available for people to take advantage of, and we would encourage you to do so, especially if you have fevers, headaches, body aches, shortness of breath, difficulty breathing, gastrointestinal symptoms. If you have a loss of sense of taste or smell, any of those symptoms might indicate COVID-19 infection. And in order to be sure, if you want to get tested, that's the best thing to do. Stay at home in isolation until your test results come back. That should be within a day in most cases. And then you can be sure of what your status is. If you turn out to be positive, we need you to please follow all the orders that are given to you. Isolate at home until 10 days has passed since your onset of symptoms, and cooperate with us to name contacts for quarantine so that we can slow the spread of the Delta variant through our community, as well as the Alpha variant, which is our dominant virus, or any other version of COVID that you may have. For more information about the vaccine campaign, I'm going to invite Doug McGowen to the podium.
Thank you, David. Appreciate that. So far, more than 677,000 vaccinations have been given to people that live in Shelby County. That's a pretty amazing number. It seems like yesterday we were still under 100,000, but here we are approaching 700,000 vaccinations. And as of this morning, there are more than 300,000 people in Shelby County that are fully vaccinated. That's a pretty big number, and I will say that that is one thing we can attribute the low rate of transmission, the low rate of positivity, is the number of people that are fully vaccinated. We have seen, as we have talked about recently, an uptick in demand. It's not a groundswell, but a little bit of an uptick in demand, and we can attribute that to a couple of things. First, we do have a call center. They have about 80,000 phone numbers that they are calling individuals to try to encourage them to come on out and get vaccinated, provide information. And then also, we have individuals doing a door-to-door campaign. Now, in previous press briefings, people had asked questions, what are the results of the door-to-door campaign? I'm going to give you a few of those now. We have knocked on the doors of more than 6,000 households in zip codes 38109, 106, 126, 38115 and 114, 38107, 38117, and 38119. We focused last night in the areas of New Chicago, Smoky City, Orange Mound, and Glenview, and the feedback that we're getting are for individuals in those areas that are over 40 years of age. People are either fully vaccinated, have received one vaccination with the intention of getting their second, or are intending to get vaccinated. What we've encouraged folks who are intended to get vaccinated is to get out there and at least get that first vaccine. We have a lot of it available. It's very easy. We have free rides to your vaccine. And before that program goes away, we would encourage people to take advantage of it. The interesting thing that we found is that there is a significant number of people that did not know that children as young as age 12 could get vaccinated. And so we're seeing our team be able to provide valuable information to parents, caregivers, grandparents, aunts, and uncles about getting children as young as 12 years old vaccinated should they desire to do so, and we encourage everybody to do that. The one other thing that I would like to just, based on some feedback, one thing I'd like to share is that remind everybody, we will never ask you for your identification. We don't ask you to present your identification. We don't ask you to even have an appointment. All you need to do is present yourself, fill out the form by putting your name on there just so we can track it, and that information is protected, just like other medical information when you go to your doctor. So no appointment. We're not going to ask you to show an ID. So for folks, particularly in our Latinx community who may have some concerns, we would encourage you to come on out. That is medically protected information. As you know, we are still providing public vaccinations at 3 drive-through locations in Whitehaven, in Germantown, and at the Pipkin building. Whitehaven and Germantown will come to a close at the end of this month, and then we'll just have the Pipkin drive-through site during July. We continue our homeless and homebound vaccinations with our vaccine machines, and we continue community-based pods. I want to call your attention to a couple of them that are happening today and this weekend. Right now, at Mount Zion Baptist Church up on Chelsea Avenue in the 38108 zip code, they are providing vaccinations all the way till 3 o'clock this afternoon. So if you live in the North Memphis area, I encourage you to go on out to Mount Zion Baptist Church and get a vaccine. If it's getting close to the end of the day and you'd like to help celebrate a wonderful new business in downtown, the Wiseacre Brewery, which is down on B.B. King in downtown Memphis, is celebrating their grand opening. They actually opened during the pandemic, but they're celebrating their grand opening today. And from 4 p.m. to 7 p.m., you can get a free glass of their beer if you get a shot. So I encourage you to both patronize a business and get a free beer after you get your shot at Wiseacre. I think you'll really like their facility if you go by. It's wonderful. This weekend is special for our city and for many cities across the country. We're celebrating Juneteenth. As a celebration, we will join in that with our vaccination efforts tomorrow at Douglas Park from 11 o'clock in the morning until 7 o'clock at night. If you come on out, bring the kids and the family. If you haven't had your vaccination, we'll be happy to vaccinate you at Douglas Park. And then on Saturday at Whitehaven, we will have operating hours at the Whitehaven vaccination site all day to help you get your vaccination as part of what you're doing to celebrate Juneteenth. So with that, I have some exciting updates coming from Ms. Dorcas Young Griffin, who leads the Community Services Agency at Shelby County. Dorcas.
Good afternoon. I am Dorcas Young Griffin. I'm the Director for the Division of Community Services with Shelby County Government. I'm thankful to have the opportunity to join my colleagues in public health today in the city of Memphis and to share with you, the Shelby County residents, some important information about services available even as we enter summer where things have transitioned. We still have to address many consequences of COVID. First, I want to talk a little bit about some of the supports that are available for housing stability. Throughout COVID, we have found ourselves really trying to place a priority on making sure that people get and remain stably housed. In addition to the funding that we've received from the federal government for emergency rent and utility assistance for residents that have been impacted by COVID, Shelby County continues to operate our regular cycles of assistance for rent, mortgage, utility assistance, and homelessness prevention. I want to stress to everyone that help is available. I encourage any resident in Shelby County who needs assistance with any type of rent, mortgage, utility need, please reach out to us at the Shelby County Community Services Agency. You can call 222-4212, or you can visit shelbycountycsa.org and learn about the opportunities to apply. I would also like to state that throughout this pandemic, we have really been inspired and encouraged by the collaboration of many of our community partners, places like MIFA, places like the Salvation Army, places like Hospitality Hub and Union Mission, and want to continue to support the work that they are doing. They have information that is on our website as well. Finally, I want to share with residents information on a few mental health resources available even as we continue to navigate everything that this past year has been and that it continues to still be for many of us. One of those supports is our COVID emotional support line. And so this line is very important for anyone who finds that they need any type of just quick emotional support just to talk through all of the things that have happened over the past year. We have seen higher rates, significant rates of depression, of anxiety, of just general sadness in everyone, but particularly our professionals that have been responding to the pandemic. Some of the available services available through this line are just COVID-19 connections, so just connecting with others that are peers that can talk through how you're feeling. There's short-term supportive counseling, and there's long-term counseling that will be referred out. The number that we would like for you to call if you need this service is 1-844-507-0144. Again, that's 1-844-507-0144. In addition to the emotional support line, we actually have available to our community outpatient services for those that don't just need a phone call, but they need to come in and see someone. Through a recently acquired COVID-19 assistance grant, Alliance Healthcare Services is able to give you more information about eligibility criteria and to schedule an intake. The number that you need to call is 319-7746, and I'm sorry, it's 901-319-7746. You can get connected with someone to have an appointment set up for you as soon as they have one available, which I think the turnaround is pretty quick right now. Some of the available services are intake, assessment, and evaluation. There's connection to psychiatric and medication evaluations, case management, as well as transportation to and from appointments. I do want to say before I close that these services are available to any resident who needs them, regardless of their ability to pay. So do not be discouraged, do not be dismayed, do not be deterred from seeking the services that you need because of your insurance state. That said, I will close my remarks and just open it up for any questions for me or any of my colleagues here today.
Mandy Rock, Fox 13.
Hey there. This is a question for anyone who can answer this, but I was wondering if you had any numbers on what % of the active cases are coming from people who are unvaccinated, if you had any information.
Thank you for the question. So in terms of active cases, almost all of them are going to be coming from people who are unvaccinated. We have a very small number of breakthrough cases. In other words, cases diagnosed in a person who has been vaccinated. There's only about 73 of those. So all the rest of the cases, the 99,400 plus cases or 300 some odd cases, would all be in individuals who were unvaccinated, or at least they were not fully vaccinated at the time they developed COVID-19 disease.
Thank you. And my second question is just about the Delta variant with the new confirmed cases. How concerned are you that there will be more of a spread as we're coming into the summer months and more people are getting out and about? What is your biggest concern with that?
Yeah, well, our biggest concern is specifically that our vulnerable population that is not vaccinated. And in order to be vulnerable, all you have to be is unvaccinated at this point, because this virus is highly transmissible. It's the most infectious respiratory virus in the world. It has about a 50% greater transmissibility than the Alpha variant, which was the previous most infectious respiratory virus in the world. So right now, if you are not vaccinated and you come in contact with someone who is shedding this virus, your likelihood of becoming infected is very high. And that's why we've been trying to get the word out this week that the Delta variant is here. And for the 300,000 or so people in Shelby County who are not vaccinated at all, we want to make sure you're aware of this, and if this is the thing that would help you decide it's time to come on and get the vaccination, that's what we're trying to encourage. But I'd actually like to invite Dr. Bruce Randolph to the podium to share his thoughts about concern as well. But this is definitely something we're very seriously concerned about.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. Dr. Bruce Randolph, the health officer. And I just want to echo what Mr. Sweat had just shared with us, in that we are concerned particularly for those who have not received the vaccine, who are not completely vaccinated, because they are the most vulnerable and could be infected with this virus. Those who have been vaccinated and who are completely vaccinated, the vaccine is 88% effective in protecting against this particular Delta variant. So if you want to get protected, not have to worry, we urge and encourage you to get vaccinated. Otherwise, the thing that you must do is adhere to the safety measures that we had outlined over the weeks and months during this pandemic. You should continue to wear your face mask, separate 6 feet or more, wash your hands, avoid crowds and poorly ventilated indoor spaces in order to protect yourself. And if you're having any symptoms, certainly get tested and stay home if you are infected, not go to work if you've been exposed as well.
Kelly Roberts, WMC.
Good afternoon. Staying on kind of the topic of that Delta variant, I know it's early, but are there any signs or numbers that you're seeing that shows that any kind of outbreak in the Delta variant may be going in the way that we don't want it to? I've noticed day after day the average case count per day goes up just by a few, and I know that those few can eventually add up. But any projections or numbers that you're seeing that don't look promising, or vice versa?
Yeah, I'm gonna let Mr. Sweat speak specific to that, but from my perspective, the things that I watch closely are a number of new cases per day, as well as the 7-day rolling average, and we're still in the 40s there, and as well as our positivity rate are the things that I monitor But Mr. Sweat can give you more information as it relates to projections.
All right, thank you for the question. So just to give you an example of how the week is going so far, on Monday we had 12 cases, 12 new cases. Then we had 53 on Tuesday, and then we had 78 on Wednesday. So we're looking to see what our numbers will be today. And, although our 7-day rolling average right now is 47, the Delta variant it could certainly undo a lot of the progress that we've already made. And we are concerned about that, and that's why we're getting the word out about it. But when we look at modeling based on the expected reproductive rate of this variant and based on how long it takes for it to become the dominant strain in a community once it's there, right now our modeling suggests that by the end of July, we could have more than 50% of the COVID disease in Shelby County be because of the Delta variant. And if things continue on the trajectory that's likely, by Labor Day, almost all of the cases in Shelby County could be due to the Delta variant. And we get that by looking at what happened in the United Kingdom. About 6 weeks ago, the Alpha variant was the dominant virus in the United Kingdom. And today, 96% of every diagnosed case of COVID in the United Kingdom is due to the Delta variant. So this variant is very transmissible, and it will wipe out all previous versions in short order if it follows its natural path as it did in India and the United Kingdom, if that happens in the United States. So this is a serious variant, and people in the Mid-South do need to take advantage of the opportunity to get vaccinated before they encounter it so that they can reduce their risk of infection, reduce their risk of severe disease, hospitalization, and death.
Thank you. And my second question is about minor vaccinations. Do we have any updated numbers on those 17 or between 12 and 17? How many of our population in those age groups have gotten vaccinated? If upticks look promising in that age group at all?
Yeah, actually, we do have progress in there. And so a week ago, we were at about 13.7% of our eligible pediatric population vaccinated. Now it's about 16.9%, so approaching 17%. So we are seeing that folks are coming out and getting vaccinated. It's not as rapidly as we would like, but it's still progress being made week over week and day over day. So we are making progress even in those youngest age groups.
Jane Roberts, Daily Memphian.
Hey, David, could you update us on the 10 cases that remain? Are they still probable? What's the situation with them?
Right, so of the 14 probables we had on Tuesday, 4 have since been sequenced as confirmed Delta variants. So the other 10 are still probable, meaning that they are a person who has disease and they're a close contact to a confirmed case. We're counting them as probable Delta variant cases. We are still trying to get sequence results on those folks if we can. We've got some runs that are underway this week. We expect more results on Friday, late in the day. So we definitely, as was reported on Tuesday, we expect this number will increase because of the testing and sequencing that's been going on this week. And as I said, 4 of the ones on Tuesday have, been confirmed by now. So.
Are you feeling pretty comfortable that it's contained to the 4 clusters?
No, not at all. That's we have 4 clusters that have been identified that are not connected to each other since June 9th. And the evidence would suggest that the virus is spreading in other ways. We expect we will find more clusters as well as more cases.
Hannah Grabenstein, MLK 50.
Hi. With the 73 cases, the 73 breakthrough cases, I'm wondering if there are any characteristics of those people who have gotten cases specific
specifically what their disease has looked like. Has it been asymptomatic, largely symptomatic? Have people been hospitalized? And then also what the characteristics of those people are. Are they generally in a specific age range, or maybe, in a specific area, or just anything that might give clues as to who is vulnerable to breakthrough?
Yeah, I don't have a detailed analysis of the 73 cases. We do know that some of them were asymptomatic. They were found through other types of testing. But what I would say, although there were some news stories earlier this week suggesting 60 people out of those breakthrough cases were hospitalized, that was actually not, that was the reverse. It was 13 of the 73 were hospitalized. 60 had mild enough illness they did not require, the disease was not severe, they did not require hospitalization, they recovered fine at home. So it's only 13 of the 73 that actually had severe enough disease that hospitalization was required. So we do believe even if you get vaccinated and experience a breakthrough case, the vaccine still is helping your immune system fight the virus and keeping it to relatively mild disease. But for more thoughts about that, I invite Dr. Randolph, if he wishes, to speak to what the benefits of vaccination are, even if you have a breakthrough case.
Thank you, Mr. Sweat. Thank you for the question. Yes. What we found is that those individuals who happen to get infected after being vaccinated still had milder cases, less symptoms than they probably would have had they not been vaccinated. This is what we do know about the benefit of being vaccinated, is that if you do get infected, because again, the vaccine is not 100%. Even in the best studies, we get 95% efficacy, effectiveness. But if you happen to be unfortunate and you get infected, what we're finding is that your symptoms and the severity of your illness is much less, and your risk of being hospitalized, placed in ICU, and dying is much less. And so, again, we want to encourage, and another reason why you should get vaccinated. One of the things I want to just point out is that some people fear the side effects of the vaccine, and they say, well, we don't know what the long-term side effects are. Well, we now have had experience of millions of people being vaccinated. Here in Shelby County, we've had over 370,000 people vaccinated. Yes, there have been some side effects and symptoms, but they're short-lived and people recover. Again, I don't think we've had anyone to die from the vaccine. But we've had over 1,600 of our citizens who died from this virus. So though we may not necessarily know all of the long-term consequences of this vaccine, we do know that the immediate consequences of this virus can be death. And it's our belief that the benefit from the vaccine outweighs the risk of the vaccine, and certainly outweighs the risk of getting infected by this virus. Are there any other questions?
Well, I do have a quick follow-up or a second question. I'm just wondering if there's any update on the vaccination campaign among the unhoused population?
Among the unhoused?
Homeless?
The homeless? Oh, okay, yes, I have Ms. Dorcas, Chief McGowen.
Thank you. It's a good question. I will have to get you the exact numbers, but we have and continue to do nearly every week a dedicated effort with our partners who do homeless work, reaching out to wherever folks who are unhoused happen to be to provide vaccinations. So that work is done through our healthcare navigators with the Memphis Fire Department. They are using one of our vaccine machines, and they go on site with one of our providers. Our providers are also bringing people who are unhoused to us, but I'll get you the numbers, but I don't want to say thousands for sure, but I know it is, I'm pretty positive we're up to 1,000 or so of the unhoused individuals. I know we're multiple thousands of people who are homebound, and we continue to do that program as well. So I'll get back to you on the exact number by when we come back here next week.
Are there any closing messages today?
Clearly, the numbers are going in the right direction in the macro level. We are going to continue to monitor the Delta variant. We talked a lot about that today. There are 4 clusters. You are at risk if you are not vaccinated. You are much more free to live your life if you are fully vaccinated without any worries about having to contract COVID. And so we would encourage people to take advantage of the opportunity. I would also encourage people to take advantage of the opportunities that Ms. Young talked about, Griffin talked about. There is significant amount of rental and utility assistance available to people here, and that also goes for mortgage assistance. There's significant amount of mental health assistance for people who may need that here, and there is more coming. So again, irrespective of your ability to pay, we will serve you. We are blessed with this opportunity to be able to provide at no cost many of the services that we're talking about, and to be able to distribute today up to $28 million of rent and utility assistance. And there's another 21 or more $1 million coming behind that to help people just in Shelby County who are experiencing difficulty paying their bills. So please take advantage of the services that we have available to you today, and share the word with people who aren't watching this. So no one should be suffering from any of those kinds of issues without having first sought some help from the City of Memphis, Shelby County Community Services, or any of our partners. So thank you all, and I hope you have a great Juneteenth weekend.
Thanks, everyone. We'll see you back here next week.